Hi, my name is Christina Ramirez, and I'm currently a student taking medical terminology. I'm going to introduce myself a little bit. I am 37 years old. I just went back to school become a health service administrator. I have about a year left to finish school, and every day I'm excited because the day gets closer and closer for my graduation. In this project, I'm going to talk about what we learned in the past 5 weeks. In week one, we learned about common mistakes. Two other common mistakes that I was able to research and I learned in week one. The first one was medical errors that occur and they are never reported. Because they are never reported, the staff that comes after a current staff, they never learn from the past errors. It says here that it doesn't only harm the patient, but it's like a domino effect. It also it affects not only the patient but the physician, the hospitals. Most of the time, the hospitals, because of these medical errors, they don't get paid the correct amount. Due to keeping them, it says here that due to keeping them in silence and they never report it, medical staff never learns from the past errors. Another medical error that I was able to research was the medication error. Medication error has been like the highest, it's been reported to be the highest cause of death in patients. An example, because of the handwriting readability, the statistics show that 2% of good handwriting is only 2%. 42% is only moderate. 52% is bad. Example of medication. I go to the doctor every 3 months for my pre-diabetic condition. There was this one time that I get my prescription every 3 months, and the nurse forgot to send the prescription to the pharmacist. When I got to the pharmacy, my prescription wasn't ready. Now, in my condition, is my condition not severe as other patients? Can you just imagine other patients with cancer medication or heart medication, and their medication is not ready and they need it? That causes a big predicament to them, and it's all due to the inaccuracy of the nurses, because they don't do the correct job. They're not on top of the patient's prescription. So that would be a medication error that occurs all the time. And I believe that it's something that the medical field should work on, to better the service for patients. Now, in week two, we learned about how do we see ourselves in the medical field. Because I'm 37 years old, I feel like I already have a late start in this career. One of my biggest concern is, because I'm 37 years old, I have to compete with the younger generation that's already in the medical field, But on the other hand, because of my past work, even though my past work experience hasn't been in the medical field, I believe that my past work experience is going to help me overcome all these challenges that I will be facing pretty soon in the medical field. I'm persistent. I'm a dedicated person. I know that if I focus myself in learning everything that I need to learn, I know that I'll be able to overcome all these challenges. Asking questions, not being afraid of asking questions, not being afraid of asking my coworker if I don't understand something. I know that that's going to help me, overcome all these challenges. Having a positive personality, especially in the medical field. There's a lot of sick people. There's a lot of people that need hope, that need that love, that caring. And I believe that myself, I have all those qualities. I know I'm willing to learn and ask for help. One of the important characteristics that I feel that I have is having a godly character. Like I said, there's a lot of patients in hospitals that are, they probably feel like, their life is at end, like they don't have no hope. And sometimes I think God doesn't make a mistake. God always puts the right people in the medical field, people that care, people that have a message of hope. And I believe that because God put me in this field, I know that I'll be able to make positive changes in patients and even medical in my coworkers, medical staff, doctors. I know God doesn't make mistakes when He puts us in this field. Week 3, we talked about a scenario. The scenario was about a nurse that was working already. She was working overtime. She was waiting for her other relief to take over her spot. The error occurred that she was in such a rush or a rush to go home, she forgot to document the dosage that she gave the patient. The next shift that came in didn't see documented that the nurse before had given the patient that dosage, and that shift gave the patient another amount of medication. Fortunately, in the scenario, the patient was okay. Like, they were able to stabilize the patient. That's one of the errors that I believe that even though the patient was okay, like if I was in that case, like I should have I should have accountability for the errors that I did. I believe that not only as a Christian but just as a person with morality, there should be accountability. Yes, there might be a possibility that you might lose your job, that you might have to face a not a penalty, but like maybe you might get fired. But I believe that the patient's life comes first. You should always be honest. You should always be have the heart to do the right thing, to even if it was your mistake, or maybe it was a mistake that maybe it wasn't your mistake, but you should always have the accountability to say what you did, even if it was wrong or right. In week 4, I was able to do an interview. I interviewed my sister. She currently works in the medical field. She has 12 years of past experiences. One of the things that I learned from her was how in the field you should never stop learning. You gotta make yourself a walking knowledge. Know the basics with perfection. Ask a lot of questions. Don't be shy about it. That's one of the things that I love about her, that even if she doesn't know it, she humbles herself down and asks in order for her to learn. One of the things that I learned in the interview from her was how she keeps herself up to date and current. One of the things that she does is she reads about new medical researches. She reads about new medical terminology, anything that she might find interesting, or things that she might not know in the medical field. She reads about it. That's one of the main thing that I got from her. That the way she learns new stuff. Another thing that she also talked about was how she writes everything down. Like, she writes. That's her way of learning how to do things the correct procedure, the correct way, by writing everything down, by writing notes, and that's the way that she learns, and that's something that I like that she does. Something that I'm gonna adapt to my career in the future. In a recap, my plan to make myself an asset to the medical field, the first step, which I'm already taking, is finishing school, learning everything that I need to learn about the medical field, learning all the knowledge that I need to learn. Second of all, I'm praying that in the near future, a hospital opens the door for me. That way I could get my foot in. That way I could get myself the experience that I need, the starting experience, to open the doors for me in this medical field. Last but not least, one of my main goals, or my main wish, is that God is with me this whole time. That I commend myself to God. That way He could help me, and not only help me, but that I could help others through me, by showing His love, by showing the mercy, by showing compassion to the patients that do need the love from God. Once again, I want to thank you for listening to my short screencast. I know this makes me a little nervous, but I hope you understand where I'm coming from. Thank you very much.